Good evening and welcome to a COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. Today, Nigeria deals with the challenge of enforcement as COVID-19 figures nears 5,000 mark. Presidential task force reveals that wearing a face mask in public is compulsory as Minister of Science and Technology advocates homegrown solutions. And coronavirus pandemic takes a toll on the American economy as more people lose their jobs. The focus now is on how to curtail the spread of COVID-19 in Nigeria, and many agree that one of the shortcomings is in the area of enforcement. Recently, there have been reports of non-compliance with the guidelines, many not wearing their face masks in public places, interstate travels at night, and non-maintenance of physical distancing, especially in marketplaces. And the security operatives have a key role to play in enforcing the preventive measures against COVID-19. Besides the empowerment of security agencies to enforce the lockdown ease directives, what else should be applied in the enforcement procedures? We'll be looking at the solutions later on the program. According to the Nigeria Center for Disease Control, NCDC, the total number of confirmed cases in the country stands at 4,971 cases, with 164 deaths recorded and 1,070 patients discharged from various isolation centers across the country. The figures by region shows that Lagos in the southwest still has the highest figure in the country with 2,041 cases, still followed by Kano in the northwest with 707 cases. In the Federal Capital Territory, Abuja, that's in the north central, it comes next with 370 cases. Imo State still leads in the northeast with 206 cases. Edo State tops in the south-south with 89 cases, and Enugu topping the southeast states with 12 confirmed cases. Barely 24 hours after the president held a teleconference with the Federal Executive Council meeting, he held another meeting today, this time with Security Council chiefs. Members of the council were seen wearing their face masks following the NCDC safety protocols of physical distancing. Among those at the meeting were the Vice President, Professor Imo State, the National Security Advisor, the Service Chiefs, Inspector General of Police. Also in attendance were the Foreign Affairs Minister, the Attorney General of the Federation, among others. Briefing the media after the meeting, the National Security Advisor says the Council is worried about enforcement and compliance of COVID-19 guidelines.
Today's meeting basically started with a brief by the Secretary to the Government of the Federation, who, as you know, is the chairman of the Presidential Task Force on COVID-19. He gave a comprehensive brief on the gains made so far, highlighting areas of concern, areas which need to be addressed, as well as making projections for the next couple of weeks. I, as the National Security Advisor, presented a couple of memos to Council in relation to the current security challenges faced by Nigeria. And of course, these are issues that revolve around the insurgency in the northeast, armed banditry, emergence of all kinds of groups that are not essentially bona fide.
The Presidential Task Force is unrelenting in its daily information to the public. In this regard, the Secretary to the Government of the Federation, Mr. Boss Mustafa, reveals that the federal government is taking the issue of food security seriously because it is as critical as national security. He was, however, unhappy with what he calls the conduct of evacuees who take to social media platforms spreading stories about their welfare at the isolation centers.
We recognize the fact that we are in the planting season and the nation cannot afford to prevent our hardworking farmers from going to their farms. We therefore use this medium to re-emphasize that farmers fall within the list of exemptions and urge state governors, local government authorities, and security agencies to please allow them to carry out their activities. The Presidential Task Force wishes to congratulate all our frontline health workers that have collectively nursed back to health a total of 1,071 Nigerians already discharged from the various isolation/treatment centers. These health workers have put in all, even beyond the call of duty. We need to tell Nigerians that COVID-19 is real, that it is deadly, and that prevention is better than cure. The Presidential Task Force is saddened by the conduct of some of the returnees who failed to adhere to the conditions attached to the quarantine. I strongly urge them to obey the rules in the facilities and also urge their friends and relations to recognize the contagious nature of the disease by desisting from visiting them. Let me remind all Nigerians that in this battle, vigilance is required, self-preservation is important, collective action is necessary, and compliance with guidelines is imperative. All this will help us prevent infection.
There were accolades for health workers by the health minister, who says many of them have gone beyond the call of duty in the treatment of COVID-19 patients across the country. Going by latest statistics, the minister said there is a drop in the number of outpatient visits to hospitals.
In infection prevention and control, case finding, case management, emergency patient transportation systems, surveillance outbreak response management analysis system, known as SOMAS, all the way down to training of hygienists, stretcher bearers, security personnel, and all others you will find manning isolation and treatment centers. Latest statistics from the National Health Management Information System indicates that outpatient visit has dropped from 4 million to about 2 million, antenatal visits from 1.3 million to 655,000, skilled bed attendants from 158,000 to less than 99,000, while immunization services has dropped to about half. The downside of easing the restrictions in the country needs to be balanced off by all citizens with a collective determination by all of us, not only to comply with protective and prophylactic advisories, but to encourage relatives, friends, neighbors, and customers to do the same.
More importantly, in the battle against COVID-19, the NCDC Director General says it may be slowed down unless government begins to dig deeper into the causes of recent outbreaks, to which research is imperative.
Of the two aviation companies.
So, Chairman of the Presidential Task Force, why do we need to engage globally? We are rethinking our response at the Nigeria Center for Disease Control from one of just going around and trying to subdue the impact of the outbreak to one that's increasingly science-led, evidence-led. We want to dig deeper into what is driving this outbreak in certain parts of the country and use that to inform the response. So how has this changed our work? Over the last few days, we're beginning to focus a little bit more on the research side of things. We've brought together TEDFund, the Nigerian Universities Commission, under the leadership of the Honorable Minister of State for Health, to start thinking about what are the research priorities for us in Nigeria and how can we drive this research. Not just in the long term, but also in the short term. And how can we now use this to improve our own guidelines, improve our training, and become a point of reference for our own response? We're participating in the World Health Organization Solidarity Trial. What does a solidarity trial mean? It means that no country on its own will have sufficient cases and interventions to have the scope of a study needed. So you bring together the data from different countries and pool them into one big study. And that's why it's called a solidarity trial, because we're all working together to the same output.
And more people are being discharged from the isolation center in Abuja. One of them who left the center this morning is the founder of Dark Communications, Chief Raymond Dokwesi. Chief Dokwesi, his daughter-in-law and 6 members of his family had tested positive for coronavirus and were conveyed to the isolation center at the University of Abuja Teaching Hospital, Gwagwalada, for treatment on the 1st of May. Chief Dokwesi indicated that he was asymptomatic at the time. Over in Edo State, the governor is lamenting what he calls the poor job carried out at the state specialist hospital under his predecessor, Mr. Adams Oshomole. He says were it not for the inadequate facilities at the center, the specialist hospital would have come in handy now that there is coronavirus in the state. Governor Basaki was speaking in Benin City today while receiving the report of the Judicial Commission of Inquiry set up in January to all construction of the facility and medical supplies.
When we instituted this panel to investigate and find out why and the hospital, the specialist hospital, which was built with so much of taxpayers' monies, could not be put into full operation, we did not know at that time that the world would be faced with a public health pandemic, COVID-19, as we have today. And this rather unfortunate pandemic has put to our healthcare system to test. Some people who had the opportunity to commence the process of rebuilding some of these institutions, rather than took measures and steps to further destroy an already weak system. If we find anybody or any groups of persons, no matter how highly placed, to have been indicted or have cause to be called to account for their actions, this government will stop at it will not stop until it gets to the bottom of the matter.
Still to come on the program, more on the battle against COVID-19 in Nigeria. Join us again. Welcome back. First, let's take you to Imo State, where our correspondent Edo State brings us this update on compliance levels.
Is regarding and abusing the guidelines, regulations and protocols put in place by the Imo State government on the temporary easing of the lockdown in the state. The government has threatened to effect a complete and total lockdown of the state till further notice, especially as it concerns movement of persons and physical distancing. The State Commissioner for Information disclosed this after the State Executive Council meeting at the Government House in Owerri, the Imo State capital. It says if indigenes fail to comply to the laid down rules and regulations, the government will be left with no other choice than to lock down the state completely till further notice. And anyone found flouting the orders of the government will be prosecuted accordingly.
It's a general problem. That's the truth of the matter. And the governor has warned that he's watching everybody. He's not watching a particular people, he's watching everybody because people are not really observing the social distancing rules. And they're abusing the advantage of a temporary easing of the lockdown. He has warned that if that continues, he will lock down the state completely and will make sure it's enforced. And when he does that, let nobody complain because everybody seems to be abusing it. And I want you to get it straight that everybody is abusing it. That is the truth. There's no particular section that is abusing it in a special way. Everybody. If you go to Wedra, go to everywhere, when you pass the road and see how people are crowding the streets in the name of going for ATM or going to the bank, you feel like crying. So it's a general problem.
However, the good news is that the stress and risk of traveling all the way to Abakaliki, the Ebonyi State capital, for COVID-19 testing is now a thing of the past. Yesterday, the state government commissioned the first coronavirus testing center in Owerri, NCDC certified.
Today, I'm happy to confirm that this lab has been certified and is now in use. We thank Almighty God that now we are further encouraged to carry out more tests in Imo State. And Imo State is additionally prepared the more to ensure that this fight against coronavirus is strengthened.
As of today, Imo State has only recorded 3 confirmed cases of the coronavirus disease. We'll continue to bring you up to speed with government's effort in containing the spread of the coronavirus pandemic in Imo State. From Owerri, the Imo State capital, Eyitope Kuteyi.
So just to borrow from our correspondent there, guidelines, regulations and policies, might I add enforcement and indeed finding solutions. Joining us right now to discuss more on this is Dr. Ajoke Adewale. She's a public health physician. She joins us here in Lagos. Thank you for joining us.
Thank you for having me.
And we have from Essex in the United Kingdom, Dr. Deji Olaleye, a physician intensivist with the National Health Service, NHS. Glad to have you.
Thank you, Millicent.
Let's begin with you, Dr. Olaleye. How is Essex beating the coronavirus?
Thank you. We're not doing too badly in Essex, actually. Essex is a county just about most of Essex is within 100 miles northeast of London, and we have about 214 cases per 100,000. So for a population of 1.5 million. That puts us about just over 3,000 cases. So we're not doing too badly overall when you compare to the rest of the country.
What are your thoughts about the COVID-19 lockdown rules as to how they differ in the UK? We also understand the 5-tier stay alert system is in place. What do you think of that?
Well, I'll take your question from behind, your questions from behind, rather. So the 5-tier stay alert system, it's more of a sort of barometer. It's an indicator for us to assess where we are and the severity of the lockdown measures that need to be initiated at any point in time. There are 5 stages, just as you rightly pointed out, from low to mild, to moderate, to substantial, to severe, and to critical. So the key thing is it will be like a reference point where from time to time we assess where we are and we'll determine, the more critical we are, the more severe the cases are, the more intense our interventions in terms of lockdown will be. At the moment, with effect from yesterday, there's been a sort of reduction in the degree of measures that were implemented at the start of the lockdown. Now people are allowed to go out more than once for a duration that can be unlimited, so to say. They are even allowed to drive as far as they can, provided that they return the same day. And all these have been informed by the steady decline in the number of cases that we've seen in the UK. So I think it's still a rather precautious situation, or rather precarious situation, I think so to say. But I think it is reasonable that after such a long time, such strategies are also employed. So it's a 50-50 situation. So
all right. Let's come to Dr. Adewale here in Lagos. Our cases are nearing 5,000. Lagos is the epicenter with over 2,000. Do you see Lagos locking down?
Now, that's a tricky question because definitely we know that locking down flattens the curve quite a lot. But the government, whether it is their fault or not, has not been able to get the trust of the citizens. A lot of citizens during the last lockdown did not receive any palliatives. Some even lost their jobs after the lockdown. So telling them to go into another lockdown is quite demanding, although we know that it will definitely reduce the incidence of cases in our society. In fact, I saw something on Twitter the other day. The Lagos State government was creating a poll, and I saw the level of responsibility citizens took. More than half of the people wanted a lockdown. That shows that people are committed to flattening the curve. But what can we handle it? We had 2 chances at it, and I'm not sure it was well managed.
Will knowing the locations where we're having more and more cases, community transfer, the clusters, will it help us prepare?
I doubt that. It's good for the planners, for the public health physicians or the people that are making the plans generally, for the stakeholders. But when you consider the general public knowing where the high cluster of cases are, I think that is not very useful because it's just going to hype stigmatization. You're going to have more people stigmatizing, not knowing that. Come to think of it, there's no rule that says you can't leave Alimosho to VI. Even if there's interstate, there's some inhibition of interstate travel. But in between local governments, you're free to move as long as you have a car. So doing that might not really do so much. You have people in VI with domestic staff in Alimosho, people in Surulere, so it won't do a lot for us.
Let's find out from Dr. Olaleye, and that is your view about how Nigeria is doing with regards to the lockdown ease directives and the number of cases that we're seeing.
Well, I think we can start by accepting that Nigeria had limited capacity to test to begin with. So the number of positive cases we're seeing may not be a true reflection of the situation. In the same way, we had limited resources with regards to how long of a lockdown we could afford, with regards to the sort of measures that could be implemented to maintain the lockdown as well. So, when I consider all these, I still manage to sort of give them a pass mark in terms of performance. Nigeria is not homogeneous. There's a wide variety of there's a wide variety in terms of geography, in terms of demographics from north to south, in terms of ethnic and political factors. And when you look at it on a state-by-state basis, really there is no one-size-fits-all. So some states have a fair share of private sector involvement. Some states almost have nothing. So it's hard to say. I will still, give a pass mark, given the limited resources available to agencies like the NCDC.
Especially testing. But we heard that it's compulsory now to wear the face mask, according to the Secretary to the Government of the Federation. Does a handkerchief suffice as a proper coverage to prevent the droplets and to protect yourself?
I absolutely worry. It's true that using something is better than using nothing, but this virus is so tiny. And when you consider the level of respiratory hygiene out there, it's so bad. Even with the surgical mask, before the rules came out, I knew people that were using the same mask for a week. And, these are people that will use the same face masks they use to clean their face, to wipe their neck. And you know that the reason why we are using this mask is so that the outer layer protects you from the environment. So let's say the virus is stuck on the outer part of your improvised face cover, and you handle that badly. So it's a good law. It's a good rule. Everybody's just seeing what we can do. People are putting their heads together. But in terms of respiratory hygiene, we need to prioritize a lot of education about the proper use of, instead of just saying handkerchiefs that can go.
All right. We appreciate your time, Dr. Ajoke Adewale, public health physician, and also thank you, Dr. Deji Olaleye, physician with the NHS, who joined us via Skype. Thank you.
Thank you.
And the number of Americans seeking unemployment benefits jumped almost 3 million last week as virus shutdowns continue to weigh on the U.S. economy. The filings brought the total number of new jobless claims since the middle of March to more than 36 million. That amounts to nearly a quarter of the American workforce. The weekly figures have been falling since the end of March, but remain massive by historic standards, eclipsing the prior record of 700,000. The NCDC and WHO website has the latest, and you can find the latest guides on the pandemic there. That's our program at this time. Thank you for watching. Another COVID update comes your way again at 9 p.m. Until then, continue to wash your hands and use your face mask.